Okay, so we will call our Community Service Commission meeting to order at 5:32. Reminder for all commissioners and staff to speak clearly and loudly into the microphone to ensure a quality recording is made. Please silence cell phones. Item number 2, approval of the September 27th, 2023 Community Service Commission meeting minutes. Do we have a motion to approve those minutes?
Yes.
Second?
Sure.
Do we have a second?
I'll second that.
Okay. All right. Item number 3, public comment. Any person may directly address the commission at this time on any item not on the agenda or on any item that is within the subject matter jurisdiction of the commission. A maximum of 5 minutes is allowed for each speaker. Any public comment? Nope. Okay. Item number 4, Keensburg Healthcare District Grant Cycle 2024.
Well, good evening, commissioners. Thanks for meeting tonight. Just really quick, we want to update you on the Keensburg Healthcare District's grant cycle 2024. Every year, the Keensburg Healthcare District opens up a grant cycle up to the community within their jurisdiction to submit grant applications for various needs for the community. A lot of it falls within health and wellness and just community engagement in general. We've sought grant applications with the healthcare district in the past. This commission has always advised a couple or recommended a couple of applications to be submitted to the Keensburg City Council every year. The grant application has opened up January 1st and it closes May 1st. So we have a couple of months to get some ideas going about potential projects this commission would like to see us seek assistance with the healthcare district. We will be taking this list back to, or any ideas back to, the Keensburg City Council. And they will have a final say of the list of applications that the city seeks in general. And that includes from other departments. Police, fire, and public works are usually the other departments. So community services is my department, and that's where we would recommend our projects from. So with that, I just hand it back over to the commission to kind of discuss or generate some general ideas of what they'd like to see as projects for this coming year. Like I said, I take this back to council in February, so any ideas from tonight's meeting will be generated to that list and then presented to the city council.
Okay, got it. Thank you. Do we have any ideas? I know last year we did the playground stuff,
Yep.
right? The pad,
The rubberized.
the rubber. Yeah,
Yeah.
So that's. Does anybody else have any ideas for that grant?
I do, unless so the letter we received from the aquatics boosters, and then something that you sent out to us in terms of this, I mean, the pool is one of the most community activities, especially because Kingsburg is so hot a lot of the time. But I was just wondering if this would be one of those really good ways to support. I know the city has a piece, it's the high school has a piece, but would a grant help in its efforts? Because I know how expensive, I mean, the pool's old, it was built when I was in high school, so. So, I mean, maybe that would be one of the ideas. I don't know. I know you guys are just starting to look at this and what the cost would be, but that would be a consideration that I would put forth to my fellow commissioners.
That's what I was kind of thinking too.
Okay, definitely something we could, because it is a joint venture between the city, the school, and the healthcare district has given us funds for the pool in the past. In 2019, we sought funds for the resurfacing and replastering of the pool. And that was a huge help from the healthcare district. They did a heavy lift on that one to get that done, which revitalized and ensured that the city would still have a pool for the next couple of decades. So that worked well. But yes, I could add that to the list. One of the council members did have that same recommendation at the last council meeting. So yes, that's something we can put on the list and then represent to council to see how far they'd like to take it. So
Curious, are the healthcare grant, is that
So it's within their scope of, I want to say influence, but it's anything health and wellness related. Anything for the betterment of the community, whether it be physical, mental, social, it's anything that falls within it, which is a very wide spectrum if you think about it. I think you can get a lot of things to fit within that, that scope, so.
Awesome.
What about shade structures for some of our other park equipment? I know there's a couple parks.
Yeah, that'd be great. So
Yeah, definitely.
downtown park, currently Memorial Park, are two major parks that don't have, there are two community parks that don't have shade structures over the playground. So we could definitely look into that.
That'd be good.
Curious how much money that is that we have.
Well, this
Or
is
the
for the
grant.
grant, so.
Oh, we don't have it
we
yet.
don't, no.
Okay,
So we
okay.
would just submit our ideas, and then it's just a matter of, once we have the ideas, then
Okay.
they'd come up with that. and
Okay,
then
cool.
present
Yep, yep.
Yeah. My other thought, I know that this grant also helped a lot with the senior center. And so I know that our senior population is growing as we all are aging. And I'm curious, is there anything else that is needed for the senior center or for the general health and well-being of the seniors? I know we've done a lot recently in the last, I would say, 5 years, which has been super beneficial, but I don't know. I mean, is there more that can be done there? I know the kitchen was revamped, and that's providing a lot of healthy meals. Food insecurity is a big thing with our current economy.
And that is it correctly. The food insecurity is one of the main focuses, and we've had several meetings with the healthcare district on senior food insecurity. So there are some initiatives that they're taking. They're trying to look into with partnerships with local grocery stores and with KCAPS, and with the senior center in general. So that is on their radar for things that they'd like to see. So that's one thing we'd like to kind of look into. So I can add it to the list on maybe senior citizen food insecurity programs or.
I have another one about the senior center. My parents are, whatever, they're members or whatever. But do they have like better, like more classes, like fitness and like health and wellness or classes for seniors? Like there's some, but I noticed there's not a lot.
Yeah, so there are some, but those are provided through the Kingsburg Senior Inc. nonprofit. It's the partnership that the city has with the senior nonprofit group that runs those classes. In 2022, the Senior Inc. board went and they sought funding from the healthcare district, and they did receive it, and that was to provide painting classes, ceramic classes, exercise, and I believe line dancing was in there as well, just to help fund those projects going forward. So there is potential for that group, the Senior Inc. group, to go ahead and go back and seek funding for potential new projects or just continue the projects they currently have. So Senior Inc. is on board for that. So that's what they're looking into.
So can I go back to the food insecurity piece? I know that Meals on Wheels has a long waiting list, and I don't even know how many of our Kingsburg senior residents utilize it. But I'm wondering if there's a way we could fill that gap. That was kind of my question that I posed to all of us and to the city council members.
Nice. So that one of the initiatives that the healthcare district is potentially looking into is meal boxes, monthly distribution or bi-weekly distribution of meal boxes. Not so much, for seniors, but also for families as well.
Yeah.
But their focus wants to be, at least having resources available for seniors that need it. And that it goes along with other toiletry items, hygiene products that they might not be receiving on a regular basis. So that is one of the ideas that they have. And I'm not sure if they've taken action, but that is what they're looking into. And with that, they'd like to partner with the city, with KCAPS, local grocery stores to provide that. And so hopefully that helps kind of bridge the gap there.
Yeah.
There are seniors that visit the senior center that do rely on the meal program there. Whether they don't have the capabilities of cooking at home or they just don't have the skill or
Right.
time to do it. And so they do rely on our hot meal program. But if there's a way for us to continue to, provide more than just what's there Monday through Friday, that's what we're looking into. So
Awesome, thank you.
Yeah, with the produce, I I know my mom goes and gets the produce,
Yeah.
and that'd be awesome if they could do like more days, or I don't know.
Yeah,
something
right
like
now we have a vendor that comes and provides a free farmer's market that does vegetables and fruits and vegetables, on a weekly basis. It's free to seniors. They don't have to be senior center members, but they come in on Tuesdays at 10 o'clock. And we give them a couple bags, and it allows them to at least, supplement their diet when there's, a lot that they don't really go out to get at the grocery store, whether they can't afford it or it's just, out of the price range. So it does expose them to a lot of that stuff. And so, enhancing those type of programs is what we're looking into, so they can receive more.
Good. Any other ideas, comments? No?
There's always the TNR efforts and,
Yeah.
TNR?
well, just the animals in general that are, we have a lot of need.
Yeah.
I don't know exactly what that looks like, but
It would be great if we could have a vet here in Kingsburg that does it instead of having to go all the way to Fresno. The vet here won't do TNR.
It's a process, so it just, usually it's just high spay neuter, the way they do things. It's a little different. Yeah. But
We still have funding for a TNR program. It's still active essentially in the background. The volunteer base has gone down, so actually actively running them on the weekends is something that we don't do. But the city still has the cages. It has funding. And it has my department's support on getting groups together. If they choose to do TNR, we can walk them through how the process works, and Public Works is on board with picking up feral cat cages and taking them somewhere. That's just the hard part, is finding out where to take them. That's where we used to have a partnership with Fresno Humane, and then that kind of died down when we received a letter saying they no longer take feral cats. So finding a local event that's open to appointments on a regular basis. And not so much restricting on the number of cats that we can potentially take. The way it's worked in the past is you set it up by appointment, and when we do a TNR, we don't know how many cats we're going to potentially catch, other than the number of cages that we have out. So if we set appointments for 10 and we only catch 2, then we're on the hook for the 10 because we made 10 appointments and we only have 2 cats. And so that doesn't necessarily work in our favor. So if we could create a partnership with a local vet, that'd be willing to kind of help us and assist us with that on a regular basis, then, definitely we, like I said, the city would, potentially fund it. We have funding, so we're not asking for donation. We're just, asking for that partnership or seeking that partnership. So that's where we currently are with.
So that's all we need. I've called around, and man, like a lot of, I don't know why people don't want to get involved in that, but you would think.
It's difficult, yeah. So I know your support has been great in the past. I know we've sat down and talked about, how to get this program going, and we've had a lot of other concerned citizens, the same thing. And just waiting for that one little box to be checked, and then we can, go from there.
So
we already have funding for it, so it's just the vet part stuff.
Correct.
So I guess,
go ahead.
Vet and volunteer, because again, it was a volunteer-run program. The city doesn't, my department doesn't have the staff to continue to go out there and set up all the cages and the food, and then go in there in the morning and check the traps and tag them and then send them up to Public Works. And it's a process, and Commissioner Chambliss was involved when we initiated the program, and she can attest to that. It is a lot of work. It takes a lot of manpower.
will they pay the vet, or is it a
Yes.
vet? Okay. Maybe we can try to call around again and see if
Yeah,
any
that'd
vets
be
would be
great. If
interested.
you'd like to sit down, and we would do a subcommittee if anyone
Okay.
else is interested, and
Yeah, might as well.
we
do
look at that. So.
Why is it such a hard thing for vets to want to commit to something like this? Spaying a cat is not difficult.
It's the staffing.
I see.
It's the staffing, because you have a vet who's doing the surgery, and then you have another staff who has to monitor, get the animal out of anesthetic, and staffing, and
Dealing with, just from my perspective, dealing with the cats in the cages aren't always the greatest.
yeah.
And then, obviously, they're community cats, so they're not well taken care of, whether they have infections or they have fleas or they have, and sometimes with the population, with vets clientele, they have, pets going in there. They don't want to intermingle the two, and that's just from my perspective, from what I've seen with other vets. Kingsburg Vet in the past has told us no feral animals. and I can see why they, wouldn't want to take that initiative, so.
Yeah.
Valley Animal Center used to do quite a bit, and they would work with different TNR, and they just had a certain window and and they would just take as many as they could, and then, but if you showed up with cats that you had trapped and they were maxed out, that was it. But it is a process, like in terms of the staff having to handle the cats, and then they have to shave them and they have to prep them, and it's a staffing thing, and it's a volunteer, it's a lot of work. I'm not saying it's impossible, but I think that's why it's not so attractive to people and to vets.
Yeah. Liability too. Just, yeah.
And yet,
It's a whole
it makes
line.
a huge difference in the community, because then they'll stop reproducing, and then they'll protect their area.
Yeah.
Yeah.
So,
I think it's something for us to look into again and open up conversation with the doctors.
It's an annual revive. Let's see what we could do.
Yeah.
Okay, well, thank you. I'll take those recommendations and we'll add them to the list, and once it's compiled, we'll present it to council and we'll see what their directive is, so, thank you.
Okay, awesome. Right, item number 5, dog park discussion, report by Community Service Director Adam.
Thank you. So again, this is just an update on the dog park. Like I had mentioned earlier, this commission hasn't met since September. But the last time we did meet, there was a rendering of the dog park that was approved to be sent to council. And so we sent that to council in October, and that it was approved essentially as that's how we were going to start the project. Working with engineering on actual numbers for the project. We did send out a rendering not too long ago to the public to review, and we did get some feedback from the public, which is great because it means they're either reading the newsletter or they're going through and they're actually taking time to review our project. One of the main concerns was the use of the oleander bushes, and that came across our desk several times for the dog park, and so we reassured the public that they will not be used in the final project. They are still listed on the rendering. But at this point, the rendering itself is not really relevant to the engineering portion. The picture is done. They have the general idea and concept of what the park is going to look like, but they're not going to go redo a rendering to remove certain items. They just know that within the final project and when engineering numbers come in, that it won't be included in the project. And so with that, we're just waiting on the final numbers to see what it looks like. We did have some other concerns regarding the fencing. We wanted a brick wall fencing along the back. We wanted additional shade structures, and I believe there was some lighting or bathroom concerns. So those will be addressed. Those were brought up by this commission to the city engineer in September. So he is addressing those. He just wants to make sure that the numbers work and that they fit. That was our directive, that we want to see a brick wall, but if it fits within the 2.2 million that we have for the project. And so with that, hopefully I have a better update for you in February. I met with him last week, and that was kind of his update, is that they're just waiting on those numbers to come in, and then we can go from there. Once those numbers are in and it goes to council and they approve, then we can start the project, potentially the bidding process, and then go from there. So estimated completion is still within this year, so we're on track. We're just waiting on those numbers.
Awesome. Any questions or comments? No. Okay, item number 6, Community Service Department grant update on project timelines, 2024.
Perfect. So this is just a general, I want to give you an update on everything community services related. For this coming year, there are projects on the community services park side that didn't necessarily make it through the commission, but it got pushed in with other department projects. The city council approved, and I don't remember when it was approved, Memorial Park restrooms renovation. So that was approved by the finance committee and city council for a project to be completed within this year. They're going to be establishing the prefabricated restrooms like we did at Athwal Park and the dog park. There'll be another building that's added to Memorial Park directly behind the current restrooms. It was, I think, more cost effective for us to put in a new structure than it was to go ahead and try to renovate the current restrooms as they are now. And so it was a $400,000 project. It'd be 4 additional restrooms, single stall restrooms, and again, the same design that we use at Athwal Park that this commission said this is what we'd like to use, will essentially be the basis or standard for park restrooms, which will be the same for the dog park. Size will be the only thing that's different, is that this is a 4-stall restroom rather than a 2-stall. And so that project is underway, completion in 2024. Was out there this afternoon to look at site location. You can actually go to Memorial Park and you'll see directly right behind the restroom, there are markings on the ground for its proposed location. So that I'm excited that project will get done, and I think the community will enjoy it, especially for all the events that happen to take place at Memorial Park. So that will work. The second project is the pour in place rubber projects for the downtown and Memorial Park. As Commissioner Chambliss mentioned, last year the healthcare district granted the city funding for the pour and play at downtown and Memorial Park, and that's replacing the bark, the wood chips, which just is a cleaner, safer kind of play surface for kids and families to utilize. Also helps with ADA access because it's easier for wheelchairs to be rolled on the pour and play than it is the wood chips. And those projects are underway. We're waiting for one more project, which was the Clean California project, and they provided funding for the shade structure and the pour in place at Heritage Park. So right now we have 3 parks that will have the pour in place rubber, which is downtown, Memorial, and Heritage. And then Heritage is also getting a shade structure above its play equipment. So that really revamps the majority of our community parks. It'll bring them all in line with future parks where pour and play is the standard. So that we'll slowly see the city get away from all of the wood chips. So it'd be nicer for the community, longer lasting, just cleaner and easier maintenance for Public Works, the Public Works Department. And again, that's slotted to be completed in 2024. So we're hopefully on track for that. And then, of course, the last one is the Athwal Park restroom project. We saw completion of that in 2023 with additional grant funding from Prop 68 and T-Mobile. They went out there and added additional funding for those restrooms, and those, again, are open to the public and are being well used. There are some concerns for graffiti vandalism. We've seen a little bit more there than at the other parks. But Public Works is keeping up on it. They do go there on a daily to open them up and make sure that it's pleasant for the community to use. And if it's not, then we close them down. So if you do hear that the doors are locked, there's probably a maintenance concern that they're working on. So, but with that, those are all our projects. Other than the senior center kitchen remodel, slotted to begin in March of this year, and that is funded by the healthcare district as well. That was a grant that we received in 2022. We've had some complications with getting the project going, but that was just due to a loss of an architect that an architectural firm transitioned over, and then we had to restart the process with a new one, and that takes some time. So it's slotted to begin in March, and it should be a 60 to 90-day turnaround, which will be great for the seniors and the senior center. They'll have a full functioning commercial kitchen that they'll be excited to use and go from there. So a lot of projects on our radar. Definitely a lot that keeps the department busy, and just appreciate your guys' support. And again, these are just projects, again, we want to clear out for this year, and hopefully make room for more. So if the healthcare district gives us additional funding for new projects, then we can go from there and keep going. So
Awesome, that's super exciting. I did have one thought, I don't know if it'd be on the subject or not, but the park equipment. I know we had talked about turning that one slide over there, and then bringing in possibly some sensory equipment too.
That was a request from one of the council members that they'd like to see inclusive and ADA play equipment implemented within some city park, whether it be a new city park or including it in current parks. I believe there was a brochure that I shared a couple months ago. It seems like a while ago. With just ideas or items that are being used by the public at other community parks. So definitely on our radar for something we'd like to do within the new Parks Master Plan. And we would like to create an ADA accessible park. And today, believe it or not, I saw on ABC 30 that Fresno just opened their, or not Fresno, Visalia just opened their first inclusive ADA playground. And so it'd be nice to go pay a visit to that one and
to go see it.
and kind of use that. So
Do you know what it would cost for one park versus like being able to do that for all?
so it depends on items. So if we did it for all the parks, it would be certain items that might be included. Not necessarily removing the play structure, but adding some sensory items to each of the parks. And that, again, just depends on the price of the amenity as compared to just having one general park that might be able to accommodate an actual play structure that, has wheelchair ramps on it and just multi-use swings and stuff like that. They can.
And the only reason I say that would be, well, it would be great to have all our parks be inclusive, but the main concern would be is if we just have it at one park, we're not reaching our entire population, and there are people that have not just access issues, but being able to drive to locations, so.
Yeah. No, that is a genuine concern, and I appreciate you bringing it up, because that's, again, we'd have one, it's like I guess the concept of a dog park or a skate park or, a pickleball park where they have to go to a specific location to enjoy those types of amenities. Whereas you could, since it is more, inclusive, we could potentially look at adding certain items to at least the community parks, Downtown, Memorial, Heritage, Athwal. Those are our community parks, and then you have all the little ones that are popping up, Nelson Park, Viking Park, like all the other ones within the home developments that might not be the grasp of actually putting stuff like that, but just the larger ones. So yes, we could definitely look into that. I could resend the brochure, or at least the catalog. They release one every year, so we could potentially get a new one. So I can send that out to the commissioners for you to review and take a look and kind of see what's being offered.
Yeah.
A lot of them are sold as per piece items, so we don't necessarily, have to buy a complete new play structure, but there are certain swings and certain pieces that we could potentially add to existing parks, and that would, definitely be nice to include. So I can
Yeah.
send that out if you'd like.
That'd be great. And then would that be something that we'd want to look into the grant about getting funding for?
Yes, I could definitely put something, so what I'll do is I'll put something together, I'll send that out before the next commission meeting, and then we can take a look at presenting that to council, just as a general idea. Unfortunately, the next council meeting is gonna be before this meeting, so we'll have to do like a general inclusion of, inclusive play.
Kind of with the
at
shade
downtown
structure
parks.
and, yeah.
And then if council goes and moves forward with that request as an item for grant applications, then this commission would meet after that, and then we can kind of narrow down what it is we're actually looking at. So yeah, we could do that.
That would be an incredible act of community service to have all-inclusive ADA sensory for the main parks. What did we say? There's 4 or 5 of them?
4.
That would be outstanding.
That'd be awesome.
Yeah. Awesome. Cool.
Go big or go home.
I know. Any other comments on the updates? Nope. Okay. All right. Item number 7, unscheduled matters for commission members for discussion only. Action may not be taken. Items must appear on agenda as a specific item to be acted upon. Any unscheduled matters?
I was just going to say regarding the healthcare grant, have we discussed like having like a community center or something where we could have like classes for free for the community, or like teaching someone how to do yoga or yoga or tai chi, whatever, like a little community center
So more similar to like the senior center, but for
for the whole
Age.
community. Yeah.
I don't
Just a
think we've ever
thought.
talked about that.
Yeah, I could definitely bring up some ideas. I know that was brought up by a council member. Same,
really?
Same concept.
Oh, really?
Okay.
Of a community. Yeah, council member Silva was the one
nice.
that said, "Hey, we could, because I think the idea has always been out there that the community needs a community center." When we were on the track for the sports complex, there was the idea that there was going to be a recreational building with a gymnasium, classrooms, cafeteria, auditorium type setup, and that is included in the sports complex plans. But I think the ask for that project, or the need for multiple groups to come together to make that, you know, an actual reality, is kind of where we kind of stopped on that project. We need community buy-in. We need other partnerships. So definitely something we can look into, at least to kind of get the ball rolling. Maybe it's something that, you know, all sports groups in the hospital district and the city and the Hillbloom Foundation all sit down together and say this might be a project worth looking into. But as of now, between just the healthcare district and the city, I think the sports complex was a $42 million project, just in general. So I think a community center would be a really big ask, and it would take multiple.
Have they thought about breaking that sports complex idea into like stages? So that the community center could be like the first thing?
So I think they did break it into stages, but the community center was not the first. No, they figured the sports complex, the green spaces, the fields would be easier, irrigation and getting all the sports, you know, green space, because that is where the general idea of the sports complex came from. We need softball fields, soccer fields, we need places for our kids to play, and so that would probably be the first part, and I think the recreation was pushed to the very end. That community center was, well, it's a nice ask and a nice request, but, so yeah, definitely something we can look into. Appreciate you bringing it up.
Are there any spaces within Kingsburg that would even be amenable or to a community center? I mean, I don't know. I feel like we're getting bigger and there's more space, but I don't, in terms of buildings, but I don't know.
Yeah,
That's even something we would,
yeah, the business park might be.
that's what I was, but then, would that be accessible to kids? How would that work?
Yeah, it's definitely big. Like I said, it's a big project. There's a lot of tentacles, a lot of moving pieces, and definitely needs a lot of support from Kingsburg organizations to get something going. But it's in the works. I mean, it is you know, in the scope of what the city would like to see. The healthcare district is you know, expressed that they'd like to see a community center. So the interest is there. It's just putting it all together. That you know. But so if you know of any land that's open, you know, let us know. But,
Got it. Does anybody else have anything? Nope. Okay. Item number 8 is a motion to adjourn the meeting. Do a motion to adjourn? Motion, do a second?
Second.
Okay. We'll adjourn the meeting at 6:05.